Okay, well, I think we've got most everyone logged in. Hi, I'm Barbara Grasecci. Wanted to welcome you to our webinar tonight. Um, I am a part of the Community for Law Enforcement Accountability Now, which is codenamed CLEAN of Sonoma County. We started in the process of implementing Measure P, getting that on the ballot and getting that to be passed. And after Measure P passed, we said, well, there's still a lot of work to be done. So we pulled ourselves together, and we are now a nonprofit. Our mission is supporting meaningful civilian oversight, transparency, and accountability of law enforcement in Sonoma County. We partner with a lot of great organizations within the county and the state, like the NAACP chapter, Sonoma County chapter, and the California Coalition for Sheriff Oversight. And we've also worked closely with the Northern California ACLU and the League of Women Voters and other groups and organizations that are all focused on fairness, access, and equity for all. This webinar is a part of a series of webinars that we've done. We've done webinars on, the most recent one was safety in our schools, another very timely topic. We did one on pretextual stops because there was some regulation that was coming out about that to educate and make everyone aware. And also the Racial Identifying Profile Act, which we did early on when the county just started collecting all of that data. I really want to thank our sponsors for tonight because they're part of what helps us make this happen and makes future webinars available. And those are Connie Cotting, Michael Allen, and Tony Kraut. So a big thank you to them for the support for the event today. So now my job is to introduce you to our moderator, Amy Ramirez, who I know very well because she is the executive director of the Healthcare Foundation of Northern Sonoma County, who I've been involved with for a long, long time. And she is our, not new anymore, but she's our ED. So I'm excited that she's here. She's a native of Santa Rosa. She's dedicated her life to working with the most vulnerable in our community through social justice advocacy. She began her career working in family shelters in San Francisco and Santa Rosa, and later transitioned into medical social work, outpatient case management, and oversight of vital health programs while administering community-wide grants to nonprofits aimed at improving social determinants of health needs. Amy has a bachelor's degree in child and adolescent development from San Francisco State University and a master's degree in social work from my alma mater, Cal State University East Bay, go. She lives in Santa Rosa with her partner and her two wonderful daughters. So now I will turn it over to you, Amy. Thanks.
Thank you, Barbara. Thank you for that very warm welcome. Hi, everyone. Like Barbara said, my name is Amy, and I'm so honored to be with you all here tonight for this very important panel discussion. Just a few housekeeping items before we get started. This webinar is being recorded. Also, we have Spanish language interpretation available. So thank you so much to Ricardo Ibarra for translating for us tonight. We appreciate you. We're going to be listening to 3 panelists and 3 presentations. So if you have questions, either general questions or questions for a specific panelist, please do put them into the Q&A, and I will be moderating the Q&A, and we will ask all questions at the end of the 3 presentations. Okay. So this evening, we are privileged to have 3 very diverse panelists who bring a wealth of experience and expertise in mental health crisis response and treatment, as well as being committed to the overall health and safety of the people of Sonoma County. So without further ado, I'm going to introduce our first panelist, Deontay Martin, Program Specialist, Community Responders Law Enforcement Action Partnership, also known as LEAP. Deontay is an innovative leader dedicated to learning and development with a passion for social reform, which was fueled by her experiences growing up in New Orleans after Hurricane Katrina. She currently leads LEAP's effort to catalog how different communities are implementing community responders. Deontay holds a bachelor's degree in Africana Studies from the University of Notre Dame. Deontay is an advocate for social reform that will improve the quality of life for all people. Outside of work, she enjoys cooking, journaling, and spending time with family and friends. So please welcome Deontay Martin.
Well, thank you so much for that introduction, Amy. I really appreciate it. I am going to share my screen and share my presentation. I'm also going to go off camera because I have another screen and it normally looks very weird when I'm going back and forth. Amy, shake your head for me when you can see my presentation. Can you see? Perfect. I saw the face you made, Carl. Wonderful. So I am here to talk about community responders. And before I get into that, again, I just want to say my name is Deontay. I go by D, so please feel free to address me as D throughout this presentation. And I am a program specialist here at LEAP. So just a little bit about LEAP and who we are. Again, we are the Law Enforcement Action Partnership, and we are a nonprofit advocacy organization. We advocate for societal issues related to harm reduction, incarceration, among other things. But today we will mostly be talking about our work with community responder programs. So what are community responder programs? So community responder programs directly dispatch unarmed responders to handle first responses to low risk, non-administrative 911 calls for service. So these community responders are then dispatched either by 911 or an embedded professional, an external line, or a direct line. So when someone calls 911, usually they get a response from the call taker and it's like, hey, do you need fire, police? And now we have a third branch where it's like, do you need fire, police, or a community or mental health responder? With an embedded professional, this is usually embedding a clinician or a social worker within the dispatch center to triage some of those calls, either on the phone or triage them to an in-person response team. And with the external and direct line, you either have a contracted person handling those calls, or you either have a direct cell line to those responders. So who are on these teams, right? Who are responding to these calls? We want to say that these are trained responders. They're either trained civilians, peer support specialists, EMT paramedics, or clinicians. These folks are trained in de-escalation, conflict resolution, mental health, and then, so how are these programs funded, right? These programs are mostly funded through city general funds. It is very important to show residents that these programs are important to the city, and it is funded through the residents' tax funds. Usually when a program is started through, let's say, ARPA funds or some type of money that will eventually run out, it can either stop the program altogether or make it really hard for the program to expand to more responders and handling more calls. So what type of calls are they handling? These responders are handling calls related to mental health and behavioral health, homelessness, conflict resolution, trespassing, nuisance, noise complaints, welfare checks, among others. And some of these calls even include a combination of these approaches. And so where are these programs housed? Who operates these programs? Who's training the responders? Who's responsible for them? Usually these programs are housed in some type of city department, whether it be a health department, a parks and recreation department. It usually depends on who is more suitable to handle the capacity of hiring a program director, training the responders, communicating with 911 communications. That just really depends on the city. Sometimes these programs are contracted through a different agency, whether that be a community group or even a local organization who may have the capacity to further do this work and hire the responders. And so how do LEAP do this work? So our community response team, one of our main goals in this work is to reduce police response for calls for service related to nonviolent incidents, mental health, behavioral health, and quality of life issues. Another goal of ours is to use data to inform our research and inform our research to advocate, inform, and design community responder programs. And lastly, we want to advance the health and opportunity and equity of all communities and peoples that we work with. So how do we do this work? We contract with cities and we analyze their 911 calls for service. This usually means asking the city for a year's worth of their 911 call service data. And then we will go through the call types and the call narratives, which are the notes taken by the dispatcher. So usually when someone calls 911, there's a dispatcher or call taker who is writing down everything that the person is communicating. So then we take a look at those call narratives because they provide a deeper detail of what is actually happening when someone calls 911. Usually the call types that are assigned to the calls oftentimes can be misleading, which is why we look at the call narratives. For example, in Atlanta, there is a call type named Fight in Progress. If you look solely at the call type, we would completely eliminate those calls for a community response because we assume that it involves some type of violence as soon as we hear fight, right? But when we look at those call narratives, oftentimes those calls involved someone saying a homeless man is sleeping in the doorway. There was actually one call that says Black man sitting on a bench and he looks like he needs to see a friendly face. So that's pretty much why we analyze the 911 data, because it provides a better insight into why cities are calling for help. And then another way we do our work is we help cities actually design those community responder programs. And then lastly, we drive the field forward with original research. Just recently, we released a liability report, which I will talk about a little bit on the next slide. We are also working on a national map of community responder programs to show where these programs are existing in the US. And right now we've identified at least over 85 programs that will be on our map. And we're expecting that to be publicized by April 2025. So, what is the data saying about community responder programs? I think one of the first things, or at least some of the first questions that happen when we're meeting with mayors, city council members, community members is, are these programs safe, right? We want to send responders to calls and making sure that they are feeling safe. Do these programs actually work? People want to know, is it going to be beneficial to the community if we're investing our time and energy on it? So this is some of the data I was able to pull from the catalog that we have. In terms of safety, there's been no reported responder injury or death. If we go back to the first program that was doing this work, Cahoots, it's been around for about 30 years and they have not reported any type of injury or death, and neither have the other programs as well. Reducing liability, I just mentioned that we did a liability report, which we released, and we concluded that cities reduce their overall risk of liability by sending unarmed responders in place of the police for nonviolent 911 calls for service. And I can share all of these reports that I am mentioning in the chat in a second. And then lastly, people want to know, are these programs handling a large volume of calls if they are taking calls off of the plate of the police? With the catalog that we've been tracking the amount of 911 calls that community responders have been able to handle. And with the programs on our list, they have responded to 154,000 total calls per year right now. And just a little bit more specific data around Albuquerque's program, their Albuquerque Community Safety Department, their behavioral health and community responder team have responded to 81,000 calls between September 2021 and September 2024. So that's about 81,000 plus calls, because I assume there's more now that it's 2025 that has been taken off the plate of the police. And monthly data is that they divert about 5% of police department calls and respond to about 3,000 or more a month. And so where is this being done already? Here are a couple of cities where it's happening, and a few are very close and near to you all. And that's my presentation. I'll end it right there.
Thank you so much, Deontay. It's so incredible just to see the way that LEAP is using data to really for advocacy and design, and to show the efficacy of these programs, and also break down some of that stigma and that fear that people initially bring up when we talk about community responder programs or diverting calls away from police. So thank you so much. That was a fantastic presentation.
Thank you.
Okay, next we are going to turn it over to Sergeant Carl Tenenbaum. Carl Tenenbaum is a retired San Francisco Police Department officer, and he is now the Secretary for Clean. Carl spent 32 years as a San Francisco police officer who specialized in community policing and outreach, working closely with allied agencies and community groups implementing restorative justice programs and alternatives to incarceration. Carl was a hostage negotiator and a crisis intervention specialist who helped develop communication techniques for crisis management by first responders. Upon leaving police work, Carl continued to fight for criminal justice reform and police accountability as a speaker with the Law Enforcement Action Partnership, LEAP, as the reform candidate for Sonoma County Sheriff in 2022, through his work with the Community Law Enforcement Accountability Now of Sonoma County, and as a founding member of the California Coalition for Sheriff Oversight. Carl and his wife live in Sebastopol with their menagerie of dogs, cats, and all creatures great and small. So welcome, Carl.
Oh, thank you, Amy. I have to be honest, every time I hear that, my biography, I'm very impressed with that guy. I got to be honest. Mental health affects all of us, whether through our own personal struggles or through the struggles of friends or families and relatives. My own personal story is this. When I was 9 years old, my mother had a nervous breakdown. That was a term used at the time to describe various mental health crises that people suffered, or experienced, I should say. For my mom, unresolved childhood trauma, postpartum depression, and the stress of raising 6 children under the age of 12 all contributed to her numerous hospitalizations and treatments that entailed extensive therapy, medication, and even electroconvulsive therapy, which I was shocked to find they still use in some instances. As one of the older children, I took on significant household responsibilities, helping to manage and care for my siblings while also trying to help my mom recover, whatever that meant at the time. We met with her doctors to try to understand what was happening. Those early experiences profoundly impacted my life and shaped my awareness of mental health. In my 20s, I became a paramedic in San Francisco. My training focused on responding to health emergencies, trauma, illness, and mental health crises. My job was to provide aid and help people in need. A few years later, I joined the San Francisco Police Department. My personal family experiences and familiarity with mental health issues, along with my background in emergency healthcare, seemed to make me well equipped to assist people as a cop, people in crisis as a cop. However, I soon realized that police officers, including me, are not the right people to counsel someone who's in the midst of a mental health crisis. As an adolescent, my awareness of mental health issues was personal and profound due to the direct impact on my life. As a paramedic, my relationship to mental health was as a healthcare professional whose role was to render aid and provide help. As a police officer, I was now an armed authority figure whose focus was on enforcing the law and public safety. I was trained, as all cops are, to give commands, demand compliance, and to use whatever force was necessary to achieve those goals. That doesn't sound like a winning recipe. So the problem is how we came to have police officers responding to mental health crises. Police officers are trained as emergency responders, focused on taking immediate action to resolve situations. However, not all crises are emergencies that require immediate action. When it comes to mental health, the consequences can be tragic. In the past decade, police in America have shot and killed over 1,900 people who are experiencing a mental health crisis. That's 1 in 5 police killings. In Sonoma County, there have been numerous incidents where law enforcement officers either harmed or failed to help individuals in crisis, including the killing of a 16-year-old boy. Sonoma County Sheriff's deputies recently detained a person who had been reported missing from his home for 5 days. The family told the deputies that they were extremely concerned about this person's behavior, that their mental health was suffering, and that they were acting erratic and engaging in unusual behavior. Several witnesses told the deputies that the individual was acting violently and appeared to be experiencing a mental health crisis. Despite having all this information and the fact that the person met the criteria for mental health detention, the deputies released the individual. Tragically, that person committed a violent crime just an hour later. This highlights a systemic issue. Law enforcement is not adequately trained to manage mental health situations. This happens for a number of reasons. When your house is on fire, we send the fire department. When your leg is broken, we send the paramedics. When there's a crime, we send the police. However, when you call 911, if it doesn't fit into one of these neat categories, we tend to send the police for everything else, whether it's an alcohol or a substance use issue, a homelessness issue, or juvenile issue. The other factor is a lack of training. California Post regulates all law enforcement in California. Most states have a state authority that regulates law enforcement. California requires what they call a learning domain for the police academy that consists of a few hours of communication skills. It's a good faith effort to have officers focused on how to interact with people that are struggling with issues. But again, their priority, police priority, is crime and public safety, and very little to do with public health or mental health issues. In 2015, Senate Bill 11 was introduced that requires California Post to offer advanced training. However, even that training is not mandatory. I was lucky in my career that I chose to be a hostage negotiator and a crisis intervention officer. So I received additional training on top of my basic police training. That really helped me to deal with emergency situations, but it still did not create in me the person who should be responding to mental health issues. The other problem that we see is officers often lack the empathy or understanding needed for these situations, and they oftentimes bring their own biases or their own mental health challenges into the interaction. Now, at the end of all of that sort of negative stuff, I want to share some good news with you. And the good news is this. First of all, the majority of calls for mental health checks handled by the police are uneventful. Most people, even those in crisis, are cooperative and not combative. Also, most cops do possess a level of empathy and reasonable communication skills. Again, this is less about the individual officers, and it's more about the systemic problems that we're dealing with. We have seen a lot of improved police policies throughout the state and throughout the country. And we're seeing that, like I said, I received advanced training as a hostage negotiator, but now that training is being made available to all officers that are out there. But again, it's optional. They have to sign up for it. And the unfortunate thing is most of these trainings are being presented by other officers. So again, there is a break in having a professional even train the first responders in how to deal with the situation. The real good news comes on the heels of what Deontay was just talking about, alternative response models. I know that when I was a police officer, if we encountered somebody who was intoxicated, we had a mobile assistance team that would come out and take the person as opposed to locking them up in jail. We also had a crisis intervention team that was part of the city government, but it worked on a very limited basis. They would come out when we called them, and it was always a relief to have somebody more well-trained and more empathetic to the situation, handle the situation, as opposed to having a police officer do it. And again, as Deontay said, we are seeing a great increase nationwide with the alternative response models. This is the report that Deontay highlighted for us. I participated in, and I know they surveyed a lot of major police departments and city agencies throughout the country, and they're seeing a lot of progress. Now, a month and a half ago, as I was preparing to do this webinar, I was talking to Elise, our next panelist, and Elise was kind enough to arrange a ride along for me with the Roanoke Park Safe Team. Roanoke Park Safe Team is basically the living embodiment of what we want to see and what we have in this county developed to respond to people in mental health crises. So one day I went to the Safe Team office, and I went for what they call a ride along. And a couple of things that I took away from that. Number one, it was very reminiscent of being on patrol. We went out, we got into this really nice van. I had two crisis intervention specialists, not police officers, dressed in casual clothing, who went out and they had radios and they were taking dispatch calls, but they were also driving around and doing what I like to call, they were on patrol. And as their patrol duties, they would drive around and they were looking for people that were having some challenge, not necessarily mental health, but whether it was homelessness or, like I said, substance use. But yes, a lot of people dealing with, not a lot, a fair amount of people that were struggling with mental health issues. And what I saw is when they approached these situations, they weren't armed, they weren't posturing, they approached people on the level that they needed to be approached. And I have to say that every encounter, every phone, I saw them handle something on the phone, everything was handled flawlessly. So the really good news as I wrap up is that we have programs in place that are growing nationwide. And in Sonoma County, we have several programs that are working. Santa Rosa has the In Response program. So we are seeing a shift away from utilizing police to handle all of these situations. And that is a really good thing. Thank you.
Thank you so much, Carl. And I just want to thank you for your vulnerability to share your own personal story about your mother. And you hold such a unique position, having been on the inside of law enforcement and also now advocating for these alternative response teams. And so I think you just bring such an incredible perspective to this work. So thank you so much.
Thank you, Amy. Thank you.
All right, our next panelist is somebody that I've had the pleasure of working with for many years, Elise Hempel. She is the Executive Director of the Petaluma People Services Center. A 20-year Petaluma resident, Elise Hempel joined Petaluma People Services Center in the spring of 2004 as a Community Resource Manager. In 2006, served as Associate Executive Director, and in 2011 as Executive Director, a position she currently still holds. She has an extensive background in sales, marketing, and general management, gained from more than 15 years of experience in the software and services industry. Elise also has served on various boards in the community, including the Healthy Community Consortium, the Coalition to Prevent Underage Drinking, KJHS, PTSA, Little League, and others. I'm so excited to hear from Elise. The program she is about to talk about is so near and dear to my heart as a medical social worker working in emergency rooms for many years. So without further ado, welcome, Elise.
Thank you, Amy. That must have been off the Healthy Petaluma District Board, because I have to tell you, the hardest job I've ever had was running the snack bar at Little League, and that's my proudest job too. So thank you for having me, and thank you for inviting me. And I'm going to take you on a little journey on how we got our SAFE team. And SAFE stands for Specialized Assistance for Everyone. It was May of 2020. We were all just trying to figure out how to navigate through COVID. And then the George Floyd incident happened. The youth in Petaluma decided that they were going to do something special in honor of making sure people felt included. And they started what we called a kindness wall in this community. And the kids made posters and used cups and wrote happy words. And they were really focused on helping our community get through understanding the tragic incident in Minneapolis. And in the undercover of the night, one of the neighbors came and ripped all the signs down off the kindness wall. But you know, kids are resilient. They came back with bigger and louder and brighter signs and hung them up. The neighbor did not come at undercover at night. He showed up in the middle of the day while they were putting the posters down and started ripping them down. And the kids got upset. The adult was screaming and yelling. There's a video of it, and it was an awful incident. The police were called. Of course, the kids kind of scattered because they were fearful of the police. And then what happened the next week at City Council was a group of these young people came to, at the time we were doing City Council meetings via Zoom, and started saying, we want a Cahoots for Petaluma model. We want a Cahoots for Petaluma model. And our elected officials and city listened to these young people and started to do some research on the Cahoots model. And what they found was by hiring a crisis consultant from Cahoots who had worked there for a long time to come do an analysis, what they found is Petaluma could stand up a crisis intervention team, and we could probably do it with the partnership at Petaluma People Services Center, and that's how we got involved. PPSC is a multi-services agency. We have 95 programs. We run one of the largest counseling clinics in Sonoma County, and we work with all ages from cradle to death. And so we have a wide variety of services that we're able to provide. The consultant's evaluation was that in Petaluma, we could probably do about 47.6 of the 911 calls that came in could be the mobile crisis response team responding. There could be conventional responses, which would be the 22%, where the crisis team is dispatched just for well checks and those types of things. And then there's a co-response, and the consultant analyzed the data and said about 15.2% of those calls, the SAFE team could respond in partnership with the police department. Now, we have some great models already. We had the MST team, and we still have the MST team, and they're doing amazing work in Sonoma County. But if you know, and we all know how big Sonoma County is, no matter where you are stationed, if you are in the middle of Santa Rosa, it's no matter where you're going to go, it's going to take you an extended amount of time to get to those locations. So the city decided to use general fund money initially to stand up the SAFE team. And the SAFE team, we were very intentional when we designed it. We spent, and we still do, have members of the team who sit in dispatch so that they are listening to the calls coming into dispatch and working with dispatch in our multiple cities. We are in Petaluma, Runner Park, Cotati, Sonoma State University, San Rafael, and then we just signed and we'll be launching in Novato in March. But the team sits with dispatch. They get to know the dispatch because that's where those calls are coming through the 911 or the non-emergency number. All of the calls go through dispatch. So they know where the SAFE team is. And I think to Dee's point, there's a level of safety when the dispatcher making the decision that it needs to be a co-response. We are on the police radio and we can say, look, we know that individual. We know that they can be volatile at first, but they'll calm down when they see us. And so we don't need a co-response. The team works with dispatch and the officers that are also on the radios to really make the best decision on what's going to serve that individual. I also, and Carl pointed it out, one of the things we did was we were very intentional about the look of the team, in part because in my neighborhood, we had a young man who had his mental health break when he was about 14 years old. And he had to call the police department. He called the police department often. He was having a hard time with his family. He was having a hard time with school. And his only response would be to call the police. And this was when I was working in the city. And I would come home and there would be 2 squad cars in front of this family's house. And that's stigma building. That's hard for the family. That's hard for the young person. It's hard for the neighborhood. Everybody wants to know what's going on. Now we have a white van with some teal lettering on it. The staff are dressed in their jeans and their t-shirts. We're very intentional about what our SAFE team looks like so that they look like the people they're responding to, so people feel comfortable immediately. And so that's kind of how we got going. I have to tell you, we spent probably about 5 months kind of putting together our plan, launched on July 1st, which now when I think about it, is probably a very high volume call day for the police department. And there we were, July 1st, responding to all those calls. But what we found is we were able to build with our partnership with the Petaluma Police Department and the city of Petaluma, the hospitals that are in our area, the health center, and all of our other community partners, a team that really is key to responding not only to these mental health crises, but also working with our unsheltered individuals, meeting them in the doorways of stores before they open up. We now are responsible for all of the parking lots in Petaluma, especially the covered ones where we go and we meet those who are staying in the parking shelters because it's a place for them to stay warm. We're able to transport these individuals as long as they voluntarily want to transport to places like our homeless shelter or to a CVS or to the library. We're able to connect and develop a relationship with these individuals so that we can then surround them with the additional services that they need. Some of the stats, when I was looking at Dee's stats, they pretty much align with what we have. So in Petaluma, we're running 24 hours a day, and we're averaging about 600 calls a month, which equates to about 7,200 calls a year. In Runner Park, Sonoma State, and Cotati, we're averaging about 558 calls a month. And so that equals to about 6,600 calls. And then in San Rafael, where we're really only running 10 hours a day now, we are averaging about 350 calls a month. And so that equates to about 4,200 calls. In San Rafael, one of the things that we're thinking about, we run 9 to 9. In San Rafael, they're talking about adding an additional team at the 9 to 9, and then one team in the overnight hours. So as our model continues to be replicatable, we continue to develop best practices and protocols that we follow in making sure that we are doing exactly what our intent is, which is to get out into the field, de-escalate where possible, refer and wrap around with additional services, and continue to allow that individual the dignity and respect that they deserve and access to everything that they need in order to get well. So thank you.
Thank you, Elise. Thank you so much. I think it's just what I admire so much about the SAFE team is the thoughtfulness that goes in and the de-escalation techniques that you use and you think about as far as what the van looks like, how your team is dressed to really put people at ease, because we all know that folks in uniform a lot of times escalate situations unnecessarily. So thank you so much. We do have a question in the chat here. So do the dispatchers decide if it's a safe or in response that should happen? How is that decided, and who goes to the incident?
So we don't run the in-response team. That's run by an amazing group of individuals up in Santa Rosa. And it's a collaborative of a bunch of different organizations that have come together to work with the Santa Rosa Police Department. But for the SAFE team, dispatch gets those calls. Individuals can call the non-emergency number, and so we know that is somebody who is determining that they would prefer to have the SAFE team. But it really is the responsibility of the dispatcher to help understand and us navigate what is the best result and what's the best need for that individual. We're lucky in the cities that we're in. The average size of the biggest city we're in is Petaluma, and so we have 60,000 residents, and If you spend any time in dispatch and any time doing work in social services, you kind of get to know those that are probably higher users in the population that we're serving. And so what we do is we can hear the calls going out. So dispatch may decide that they want to send the police department, but our team can go on and say we want to co-respond. Or it can be that dispatch says, we want the police to stage and safe team to show up. And so we do it in a variety of different ways. More and more of the calls, we are just going out as a safe team. One of the things, unintended consequences, is we didn't expect to have as many well checks as we currently do. So, when a well check comes in, it's usually police or fire who go out and do that. They go and do the well check, but they're not able to connect that individual who a family member in North Dakota is calling because they haven't heard from grandma in a couple months in Petaluma. We are able to do that well check, but that then leads to additional connection to all of the other services that are available to them, not just in Sonoma County, but we're blessed in Petaluma because almost all of those human services that people need are housed in PPSC. And so it's a real easy referral for us.
I dream of a day when these services exist in northern Sonoma County, but we'll get there. We have our next question, I think, is for you, Elise.
If you don't mind, I really wanted to
Oh, yeah.
add on to Elise answers really quickly. There are automatic for most programs, there are automatic disqualifiers for a community response. Usually that is like the mentioning of a violence or a weapon, or if someone is acting, some programs, like if someone is kicking or spitting, they won't respond to those calls. So usually once you get past those automatic disqualifiers, those calls are then up to the discretion of the call taker, as Elise mentioned. But the central point of me saying that is that there are disqualifiers for most community responder programs, and if the calls mention any type of weapon or violence, then those calls will receive a police response, which could also lead into a co-response, as Elise mentioned, because there everyone is communicating through police radio. So thank you. I just wanted to add that really quickly.
Oh, no, thank you, Dee. Okay, I think this next question is for Elise. It's in regard to Petaluma specifically. What is your best hope for continued success in Petaluma? And then this person also referenced the county sheriff.
I haven't looked at the question, but our hope for Petaluma is to continue to be able to address, when you think about 7,200 people in Petaluma, and we're a community of 60,000, that's a large number of people that are getting access to additional services. One of the things that we've decided and understand is there's a gap in those services. There's a gap in the so a police response to somebody who is in mental health crisis is often to take them to the hospital. One of the things that we do track is diversions from hospitals and diversion from jail, because we're saving taxpayers millions of dollars if we can do those diversions, but wrap around additional services. And one of the things we're seeing in Petaluma in particular is there are gaps in services. And we know in Roanoke Park and Cotati and SSU, there are gaps in services, which is why last month we opened Roanoke Park People Services Center, a program of Petaluma People Services Center. But to have that hub that belongs to that community is really, really important. One of the things that we are working towards in partnership with the county is to be able to bill for calls that may be Medi-Cal calls that result in additional services. That's a very complicated process. Somebody in Sacramento said this is going to be a great idea and mandated it, and the county is working really, really hard to try to figure it out. And all of us are trying to figure out how we're going to implement it and add it, and how. And I've run Medi-Cal programs. How, if we're using a Medi-Cal billing program, it actually will reimburse us for the actual work we do and just not for the person who's doing the billing. But we are working towards that, and we hope to have a July start date or mid-June start date where PPSC would be able to take Medi-Cal for all of our Petaluma calls that are Medi-Cal equivalent.
Thank you. Okay, so this next question is in regard to best practices. So wondering if Ms. Martin's team or LEAP gathering best practice information along with their data and what's working where.
So yes, we are gathering best practices based on like the field is very new, right? The oldest program is Cahoots, and the rest of these programs are between the ages of 1 and 5, and most of them being in pilot years. So everyone is kind of scrambling and figuring out what's most important to track, such as diversions from arrests in hospitals and things like that. And I think one of the things that's really working well for a lot of programs is focusing on calls that have a mental health related approach, as well as calls that don't involve mental health, whereas it might be a welfare check or it might be a nuisance complaint. I think that has really worked well because the goal is to reduce the amount of calls that police are receiving. And so it's very important that they are, receiving calls from dispatch. And a lot of times in most cities, like for example, when we worked in Rochester, it was like only 3% of their calls actually related to mental health, whereas 30% of their calls related to conflict resolution, right? So I might want to hire someone who is privy to mediation and conflict resolution than hiring a clinician. If I'm being really honest, depending on your call data and what your city needs, you might not need to hire a clinician, right? But that just again depends on what it is that your program is focusing on. If there's a significant volume of mental health related calls in your city, I think another thing that is working well for programs is just having an extensive training catalog. So working with local programs as well as reaching out to organizations like LEAP, CSG, and other people who are working within this field to kind of understand what other people are doing and what are the best trainings for a community responder. So to answer that question, yes, we are tracking things. It's growing. It's what it is. It's growing.
And I will tag on. I think I often say it's better to be lucky than good. And just as we were developing the SAFE team, and Santa Rosa was looking at trying to develop a model, working with their partner from Cahoots, we were able, through a grant that the county received, the city of Santa Rosa, the city of Petaluma, and the city of Roanoke Park are part of the CCMU, which is the crisis collective that the state has put together to help develop these teams. There are monthly trainings, there's monthly learnings, there's opportunities for ongoing training for our crisis team. One of the things we're very intentional about is every Wednesday we have a team meeting where the team is able to all get together and then they participate in training. And the trainings that we are able to get through the CCMU grant funding are very, very valuable. And our team members then take those trainings and add a narrative from a real life experience to a call that they have responded to. And then the teams are able to work through those narratives. That's the best way to learn, to be able to learn together and work together and develop that relationship with each other. Tracking the data, yes, it's cumbersome because, is it an assist? Is it, all of these different languages and things like that. And there's really no standardized database. No one's really, in senior services, we have a standardized database. In youth services, we have a standardized database. There's not really one because, like Dee says, these programs are still so new. We haven't really figured out how we're going to add to and collect the data to really show the responses. But I often tell this story. The chief of police, Brian, here in Petaluma, and I actually had a conversation with the chief in LA. It was about a year and a half ago. And first, the chief here in Petaluma got on the phone and said, "You need to understand my entire department is smaller than one of your precincts." And the chief said, "Here's my question. Are your officers using the SAFE team the way it was intended?" And Chief Miller's response was, he thought for a minute and he said, 100%. And you know what? They rely on them now. It happened when the crisis team wasn't able to be on call because we had a wave of COVID go through and we missed like 2 days of service. Every single officer came into the chief's office and said, "What are we supposed to do if we don't have the SAFE team?" So that to me is probably the best data we've ever had.
If I can jump in on that real quick, just because I want to circle back, Dee cited the statistics and Elise referred to them. And the reality is the statistics don't lie. And I can tell you unequivocally that, my career on the streets, and I'm talking across the board, not even mental health cases, the level of resistance and violence out there is really, really, really low. I think we've been sort of conditioned to believe things that are worse they are. And this particular talking point, the police are creatures of habit and they push back on any change. And I think Elise just cited a perfect example of there is pushback from law enforcement. There's pushback from law enforcement unions, and their argument is like, well, somebody's going to get hurt. And the reality is the numbers don't back that up. And the reality is that's not the case. So you're 100% right, Elise, that these, and what happens, you created a culture, a shift change in Petaluma to where now the cops are like, hey, we finally got used to this thing that we were so opposed to. Because I will tell you, across the country, law enforcement is knee-jerk, they're very protective of their status and their power. And once you try to explain to them or take it away, you have to, it's baby steps. But I think we're seeing what's happening locally and what's happening nationwide as a really good sign that we are making progress and getting this done.
Thank you, Carl. And another thing that I think is really important to add is something, again, both the chief in Runner Park and the chief in Petaluma said, our crisis team is made up of a crisis worker and an EMT. And we always have somebody who speaks Spanish on the team on every call. And one of the things that both chiefs have said is, this is the most diverse group of individuals we've ever worked with, because we are able to, they're PPSC employees, they're not City of Petaluma or City of Rohnert Park, they work for Petaluma People Services Center. And so we are able to bring on a group of individuals that have such valuable lived experiences. And Carl touched on this earlier. In order to be a good crisis worker, you have to have those lived experiences. And the two team members that Carl was able to ride along with have such amazing lived experiences and have come through the other side. But those experiences they have make them more relatable to the person that they're dealing with, because it may be that it's a co-occurring issue. And so there's drugs and alcohol involved and mental health. And they're able to relate to that individual in a way that nobody else would be able to do that.
Thank you. We have a question around, outcomes. So is there any data around numbers of clients that are able to move out of the response loop once they receive wraparound support?
Dee, you're your data girl, but I can answer it.
I'll let you go ahead.
So we're seeing amazing results with these individuals. And I'm not going to lie, some of these individuals were our clients before, but they were stuck in the loop of police interaction. And listen, sometimes we did little hokey things. I've been at PPSC for 20 years. I still remember about 18 years ago, we made these little cards that officers could hand out. And it said, "You need services at Petaluma People Services Center." And the officer on the back of the card would sign it. And these people from Petaluma, these residents, would come in and hand us the card and say, Officer Tannenbaum says I need to come see PPSC, and we would figure out what the resources were that they needed. What we're able to do now is connect these individuals to the exact service that they need. And our navigator who works within the team is able to continue to do the follow-up. So individuals don't have to make the call to get the help. We are calling them and saying, okay, you said in your safety plan that you were going to do this. Have you done that? If not, what can we do to help you? Do you need a case management from senior services? Do you need a RISE clinician from PPSC? What do you need in order to help you get to that next step? And so while we don't necessarily track the outcomes, I think what we're going to be able to see once we all are billing Medi-Cal is that a certain percentage of those that do qualify for the Medi-Cal billing, we will be able to see through the data system, Smart Care, we'll be able to see these individuals progress and make positive changes in their life because of that interaction with the crisis intervention team.
Yeah, I
So
would. Oh, no, I just wanted to add on that for Albuquerque, someone in the chat had asked, like, is there like the best program? I don't like to say there's a best program. I just say there are more developed programs than others. And right now, ACS is one of the most developed programs, Albuquerque community response program. And for Q4, they responded to about 5,000 calls, and they have these VIP clients. Those are like your more frequent flyers, most people like to say. And some of the services that they were able to connect people to, 13 people to peer support, 3 people were able to get their basic needs met. 2 people were connected to a GED. I'm unsure if they got their GED or if they were connected to GED services. But that's some of the data that ACS is recording. And again, as programs start to develop, more of this data will become available.
thanks, Dee. Okay, this next question is for Carl. Wondering if you have insights as to how the general public can promote the program at the county level.
Anybody that knows me knows I have insights about everything. So I'll just start with that. Yeah, and getting past my flip answer just now, it starts here. You're here. Whoever asked the question, your participation today is crucial. It's critical. It shows that you're interested and you want to know about this subject matter. There was an earlier question about the sheriff. I won't speak specifically to the sheriff, but my answer to this question is your elected officials. You have to go full throttle on the electeds because that's where the resistance comes from. Because just like with the cops, it's a whole new horizon for them. They're not quite sure how it works. And once they understand that it reduces liability, increases community relations, that's a good thing. So yeah, definitely. And especially countywide, because I know that in her wildest dreams, Elise and maybe Amy would love to see countywide emergency response services everywhere and 24 hours a day. And that's what we need. And that requires the supervisors and, as an elected official, the sheriff too, because he ultimately patrols those remote jurisdictions.
And we do have the MST team, and don't get me wrong, they've been doing it for a long time. But again, to my point, is the county is so vast. If you don't have teams located in different areas to respond to the needs as quickly as that person can de-escalate, they can escalate. And that's when things get out of control. And so figuring out how, I mean, I used to listen to Supervisor Rabbit talk about all the miles of roads that we have in Petaluma. When you think about all the miles you have to travel in order to get to an individual who's living in a remote part of the county who may be having a crisis, what's happening to the individual that's in Pingrove who may be having a crisis? And so there's a lot of work we have to continue to do in order to meet the needs of those who so desperately need to be connected to the mental health services that are available through the crisis intervention.
Thank you. I'm wondering, Elise, you spoke a little bit to the gaps that exist in services and thinking about models that, like the Cahoots model, and other very successful models. What is missing? What services are missing within Sonoma County that would make these programs even more successful?
Well, we've had services, and then there were gaps in the services. Access to a sobering center, that type of thing. I know that we finally now have, because there was a fire, we didn't have access to sobering beds in Sonoma County for a long time. Those kinds of programs, those are what actually help people move through the outcome phase a lot faster. And so enhancing and rebuilding and adding community support. Down here in Petaluma, we ran for quite a while a program called Sober Circle, and it's based out of a program in Southern California. And with Sober Circle, it was the police department, and this was before the SAFE team, but it was the police department, the homeless shelter, it was PPSC, it was the hospitals committing to, especially Providence, committing to having some beds available for people so that they could get clean and sober. And so that's another issue, because if you have these co-occurring diseases, you've got to take it one at a time. So if you can address a addiction issue, then working on your mental health issues becomes so much more easier. And so finding ways to really expand and build a way for additional services to be available in our community. For a long time, the only clean and sober beds were in Marin County and Lake County. And so, the counties worked really, really hard to get that up and running. Right now, our crisis stabilization unit is closed, and that's putting a burden on a lot of the emergency rooms because they're not there. The county has stood up services where you can go meet with somebody, and they're doing a lot of work around that. Hopefully the CSU will be open soon, and so somebody who is in severe mental health crisis can go to the CSU and get the additional wraparound services they need. But the other thing, I look at both ends of the spectrum because I see them. I believe for the fastest growing population in Sonoma County, which is those of us who are 65 and older, I believe we need to strengthen our infrastructure on mental health services, especially around loneliness and depression. We do our You're Not Alone call, which started during COVID and now touches 3,000 residents in Sonoma County, but that means that 3,000 volunteers are also calling them. I think we need to focus on some of the prevention pieces before somebody gets to that crisis point also.
So you all spoke a little bit about the, just qualitative data around law enforcement now really appreciating and depending upon these alternate response teams. But we do have a question about, are we completing feedback in any formal way from clients, dispatchers, patrol officers, regarding satisfaction of the response?
Do you want to take that first?
Yeah, I will start with one example. I like to be honest about what is going on. So I'll start with one good example up in Dayton. The program director at the time, she was setting meetings, I believe they're called roll call meetings with police, and she would then go over some of the success stories that happened throughout the week with Dayton's mediation response unit team. That then led her to creating a survey that she would send out to the entire police department. And I don't have the direct numbers, but I do know that more than 2/3 of her police department actually responded to the survey and gave great responses and saying, yes, we want more of the mediation response unit. We love having them alleviate calls and take calls that we do think warrants an unarmed response. And so even now, the police, as Elise mentioned, are literally like, hey, we need these people. We cannot function without them. And I think that's just a true testament to the strength of these programs. And then on the same side, as I was gathering this presentation, I was looking at some information for ACS. And as you know, this is new, things happen, and when programs grow big, they also get bigger problems. And right now, ACS is struggling to get to calls faster, right? Their response times have gotten a little slower over the last couple of months, and they've also been through a couple organizational changes with their former director leaving and joining a new role in alternative response. And so that's some of the struggles that they're grappling with, and even law enforcement and the community are expressing some of their concerns for the slow responses for ACS. So I would say yes, people are collecting information on how the community, how police and dispatch are responding to community response. And I don't know if Elise has more specific information relating to her program.
So yes, we do track that, and that's tracked by our navigator, and then also it's tracked by the handoff to our additional services. I have to tell you, I have run 95 different programs for Petaluma, and most of them throughout Sonoma and Marin County, and it makes me cringe whenever I say, oh, I'm with PPSC, and they say, oh, we love the SAVE team. It's like, what about Meals on Wheels, and what about our youth programs? So our community gets it. Our community understands and gets the value. And I have to go back to my next door neighbor, whose son is now he's thriving, and made it through that hard time in his life. And she says to me every day, I wish we would have had the SAFE team then, because we probably would have gotten him into the programs that he needed faster, because the police would show up, they would do what they would do, and then they would go away, and then he would get upset at his dad again and call 911. And so we see those kinds of results, and we hear over and over. I think it's also important to note that, I've been at PPSC for 20 years. I've been working with our police department for 20 years. I've been through a lot of chiefs. And same with Rohnert Park. And so we do and are intentional at the chief level and the peer level, my peers. We meet once every 2 weeks to talk to the chiefs and the city managers. They're all part of this conversation so that we can continue to grow and address the gaps that we're seeing in real time. But, to Dee's point, one of my biggest fears is, okay, we're launching in Novato. Yes, we were able to successfully do it in Rohnert Park because PPSC has a lot of connections and services down in Rohnert Park. Not as many in Novato. We have done services in Novato, but not as continuous. So how is that going to look, and how is that going to feel? I know Aziz is on family leave, but one of our temporary managers, she was down in Novato's dispatch. We don't launch till March. She was down in Novato's dispatch for 2 days, just sitting with dispatchers talking about these calls. So we really continue to develop and grow how we're launching these programs too.
Thank you. And we do just have a final, not a question, but just a shout out. Happy to say that mobile support team is 24/7 and responds to all the areas in the county that the SAFE team and in response cannot respond to. So great job, Elise. Okay, well, unless anyone has any further questions, I'm going to open it up for closing remarks from each of our panel members. So Dee, we'll start with you.
Yeah, I just want to say thank you guys so much for inviting us to be here. I love spreading the good word about community response. And I just think it was so important that whoever asked you or the people viewing just about what we can do to really support this work, right? And again, as Carl said, it's about you guys being here, using your voting powers and really pushing those people in power to see the validity in these programs, and also reaching out to LEAP, reaching out to Carl, even to connect you guys to LEAP, doing ride-alongs. If Elise allows, some programs will do ride-alongs. It depends on who's asking. But just really staying in the know about what is happening in your city will really push you and yourself forward. And if there's anything or any resources that LEAP can provide to educate you more about what's going on, please don't hesitate to reach out.
Thank you so much. And thank you for being with us tonight, Dee. Carl.
A couple of things. Number one, in 2014, my wife and I took my mother, Miss Vivian, by an Amtrak train from San Francisco to New Orleans, where she grew up, for her 80th birthday. So my mom lived a great life, okay? Miss Vivian was the queen. And on that same sentimental note, I have to tell you that every time we do one of these webinars, it's really inspiring to see the people from the community and the community-based organizations show up and volunteer. You're all here voluntarily. And it really is. And I have to say that this was probably the most humbling one of the webinars that I've been involved in because of everybody's willingness. I've enjoyed all my conversations with everybody. And just to double down on what Dee said, you know, everybody that's here is here for a reason. I know we have some law enforcement people watching. We have a lot of variety and diversity. But being concerned about this issue, which does affect all of us, and taking some action, whether it's, you know, voting, calling your political people, or just volunteering. I can't emphasize enough that there is a sea change. You know, this is a cultural change. And law enforcement, there was a question earlier about how do the cops feel about this. Law enforcement tends to resist change like a lot of us do, but we're seeing the change happen. And it's happening really, really well. And based on my ride along with the SAFE team, it's the answer. So thank you.
Thank you, Carl. And thank you for your continued advocacy around this issue. Elise.
Well, thank you for inviting me. Thank you for playing along, and thank you to the Rohnert Park team for allowing the ride along, because in Petaluma we don't allow it. And each community is different, and we respect that. It's been an honor to be here, and it's been an honor to actually help stand up this team. It takes a lot of people. It takes a lot of willingness. It takes community members willing to say, I want the crisis team instead of the police department, because you're calling 911, you think you're going to get the police. And so for them to be able to embrace this change that's happening and how the response is happening is really, really important. I think I would be remiss if it's important that everybody know that 988 system is in play. And if there's anybody in our community who is feeling suicidal, they need to call that 988 number. That 988 number will link to the resources you need, including all of our dispatches that are available to send that SAFE team, that crisis team, to you if that's where you think you are in your need to get the additional help that you have. So please, 988 is almost as important as 911, especially for those who are in mental health crisis. So thank you for everybody for allowing me to be here and share.
Thanks, Elise. And thanks so much for all your work standing up the SAFE team and for all the programs that you run at Petaluma People Services. And thank you for sharing out that 988 number. I think that's so important for us to start using regularly and reminding each other. Okay, well, with that, I believe our webinar has come to an end. So thank you everyone for joining us tonight. I think we've all learned a lot, and I hope you all have a fantastic evening.
Thank you. Bye.